it's Mark Nimitz here from HealthXN, and today I have the honor of speaking with Dr. Ogan Gurel in Korea about his passion behind a program called the miniMD. I had the honor of meeting Dr. Gurel a few weeks ago during a health industry leaders roundtable organised by the Victorian government. And I'm pleased to announce that Dr. Gurel will be back in Melbourne on Saturday, October 10th, live for the first ever miniMD session in Australia. This is for the local health and innovation community. So we're really, really honoured to get someone of this calibre back into Australia so quickly. The miniMD program is an intensive and immersive one-day course with ongoing online support to really understand the language, the motivation, and the drivers of each type of health practitioner in the health system. It's especially useful, we found, for those people in health markets that are selling or interfacing with the health markets. It's really, really great to have Dr. Gurel before he gets on a plane for his next trip. But could you tell us, Dr. Gurel, could you tell us a little bit about yourself and the inspiration behind the miniMD program?
Thanks a lot, Mark, for the really kind introduction. It's going to be a pleasure to see you again. It was really good to meet at that Victorian State Government Healthcare Workshop. Met a lot of other outstanding folks as well. I'll actually be in Melbourne for the Asia Biotech Invest Conference, where I'll be on a panel as well as giving a research seminar at the University of Melbourne. And then, as you mentioned, on October 10th, Saturday, for the miniMD. So as you can see, I have a broad business as well as clinical and scientific background. And the original seed of the miniMD started when I was a consultant at Booz Allen. And they had actually a mini MBA program for MDs and PhDs who did not have the accounting, finance, and marketing and so forth background. And that was an intensive course as well. And obviously, I learned a great deal. And I thought that was a very good framework. And so many years later, over the past 5 years, working at Samsung and other large organizations and institutions, I wanted to package together in a short period of time all of medical knowledge, distill it down, and some sort of immersive experience that also gives a sense of the art of medicine, not just the science, the broader issues, the sociocultural embeddedness, the human side, and then also the ethical side that permeates really how doctors think, how clinicians think, and how medicine works. So that's kind of a story of the miniMD. It's been taught in Korea, in the United States, and most recently in Singapore, and really looking forward to presenting in Melbourne.
I think one of the things that might resonate with the Australian audience is that this is something that's never really been delivered to this level pretty much in Australia ever. And bringing you down here for the first time for such a program, to deliver such a program to the startup community. Do you see, in your travels, having facilitated this program, do you see much of a difference between an Australian context and everywhere else, or are these problems sort of universal?
Well, I think it's fairly common globally, the world of medicine, doctors, and so forth, and then obviously healthcare professionals or people who are engaging with the clinical arena. There is sort of a divide, and it's not just about the science, but obviously some of the experience. It's very interesting in medical school. You dissect a cadaver. We won't be doing that in the miniMD, but that's very much a very specialized experience. And so a lot of being a doctor and being in the clinical world is quite different than normal life, if you will. And so there is that kind of divide. I would say there's no significant difference between Australia and other countries. And I really tried to bridge that through this course. It's obviously about knowledge transfer. We cover all the subjects, the major subjects in medical school, obviously in a highly distilled format. We dive deep in some areas just to give a sense of how that happens in terms of clinical thinking. But it's more than just knowledge transfer. It's also an experience, as I mentioned. Again, we won't be dissecting a cadaver, but it's a very intensive experience. We cover the broader nature. There are anecdotes, obviously respecting privacy, names and are changed and so forth, anecdotes about patient care and so forth that motivate some of the discussion. And so it's really an immersive experience. And we've had these classes, 40, 100 people, and by the end of it, they are feeling, together with the participants and myself, that we're in medical school and we're really in that kind of mindset.
And I think that's the one thing that resonates when I look at the testimonials from those people that have come from a telco background, that have come from a finance background, and that they're interfacing with this market. If you read their testimonials, what they really love is that they actually walk in and they wish they did this a lot earlier. They wish they did this if they were in the medical field. They wish they did this early in their career, not at the end of their studies, especially. And if they're in the non-medical field, they say, "Oh, this really, really helps me understand the mindset of the people I'm actually dealing with when I'm actually interfacing with them." So it sounds like an incredibly immersive program. And I look really much forward to seeing you live in Melbourne on October 10th. And if people would like to register, they can certainly go to minimd.net and pick up some more details and register on that website.
Well, thank you very much, Mark. Really looking forward to coming back to Melbourne. It's a beautiful city. You don't need me to say that. And I really looking forward to it, and I appreciate it. Thank you.
Thank you.